Welcome everyone to the PFCC Partners March Workshop. Very excited to have all of you with us today to hear a little bit about the Patient Family Advisor Summit. And the topic of that summit was co-designing person-centered measurement. We have a lot to share with you all today, and we'll get right to it in just a few minutes. I have a few housekeeping items and some updates for you as well. I am Lindsay Galley. I'm the Director of Education for PFCC Partners, and will be helping to facilitate this workshop for everyone today. On with us, we also have Libby Hoy, founder and CEO from PFCC Partners, and our partners at Discern Health, Teresa and Alexis, who we'll get to in just a little bit as well. We have lots of Patient Family Advisors Summit participants on, so if you were a participant at the PFA Summit, please feel free to introduce yourself in the chat box, and everyone else, please take a moment to locate the chat box and introduce yourselves. We do have an open line on our Zoom meeting today, and so if you would do us a favor and help us out a little bit, if you have background noise or something that you need to step away and do, please use the mute button either on your screen or on your phone. I, throughout today's presentation, will also be managing the mute as well. So don't have to worry about it too much, but it is really helpful. If you would like to share your video like I am, please feel free to do so in this now quite virtual world that we are all in. It would be great to see some of your faces. And we are going to use the chat box a lot throughout today's presentation. We do have a lot of content to cover. So if you have any questions throughout the presentation today, please feel free to put those questions in the chat box and I will monitor them, and then we will have time for a Q&A at the end of our session today where we can answer a few of your questions, and then we can take some folks off mute if you would like to speak up and ask a question. And during that Q&A, you can speak up with questions by clicking the participant button on your toolbar. If you hover over your screen, you can see a toolbar where you can find the mute button, find the video button, find the chat, and also find the participant button where you can then click raise hand. And so at the end of our Q&A, if you would like to come off mute, you can find that participant button and then click raise hand, and we can see that you would like to do that. And please put any other questions regarding technology if you're having trouble joining in the chat box, and we have some PFCC Partners staff on and myself who can help you navigate. And before we get into our content today, I wanted to do a quick poll to see who is in our virtual room with us. So I am going to launch the poll. And so my question for you today is, what is your role in healthcare? And can you guys see that, or is it small? Oh, there we go. So I'll leave that up for just a minute.
See, we're still looking at the zooming slide, I think.
Okay, let me try that again. Relaunch polling. Continue.
Ah, I have it now.
Okay. Sorry about that. I'll leave it up for another minute or 30 seconds or so. Now I can see everybody. Filling it out. And please chat in your role if it isn't listed here. You know, we probably have a lot of measure developers on and research, so please chat in. Lots of patient family advisors too. All right, looks like responses have slowed down, so I'm going to end polling and share the results just really quickly. So we can see we have a lot of patient family advisors on, and I will look to the chat to see who all of our other folks are. But again, thank you all for joining us today, and please use the chat for lots of questions and conversations.
Lindsay, can you share the results?
Oh, I'm sorry, I thought I did.
There we go.
It's taken me to do it twice.
Technology.
Yeah, gotta love it.
I think there's a lot of people using Zoom these days.
Yes.
It's probably a bit slow.
Yeah. Great. Well, thanks everyone. Glad that worked out. And we'll have another poll later today. So just let me know, speak up if it's not showing. Okay, so before we get to the content, I just wanted to do a quick reminder that the 2020 PFCC conference is still on as scheduled, and requests for proposals are still open. I'm going to ask Laura Jackson to post the link for information in the chat box that you can access later, but we are looking for really dynamic partnerships with patients and families to highlight at our conference. That will hopefully still take place September 21st and 22nd of this year. And here is our agenda for today. Libby Hoy is going to kick us off with some background on the PFA Summit and patient family engagement and measurement, and give a brief update on the 2020 goals and agenda for the PFA Summit. Then we'll pass it off to our partners at Discern Health, who will review the outcomes from the PFA Summit, and we'll wrap up with a participant panel. We have Roger LaCoy and Ayodala Anis. Roger LaCoy is a patient family advisor, and Ayodala is one of our national partners as well. So we get to hear from them. But right now, I'm going to pass it off to Libby Hoy. Libby?
Thank you so much, Lindsay, for getting us started, and thanks to everybody who is taking time out of what I only imagine are extremely busy days to join us today. My name's Libby Hoy. I am the founder and CEO of Patient and Family Centered Care Partners. For those of you who are unfamiliar with us, we welcome you always. We welcome new partners. We have a tiny little vision to reinvent the healthcare system through partnership with patients and families. We feel that patients and families have unique perspective and insights about how the health system works and about potential opportunities to improve the healthcare system. And that when we set up the infrastructure across health system activities, that we have an opportunity to really leverage that perspective in a meaningful way. Next slide, please. So Patient and Family Centered Care Partners, our organization, through our work with various health systems, research teams, quality improvement organizations, measure developers, and anyone else who would like to partner with us, we've created a large network of patient and family advisors, or those folks using their lived experience in the health system to bring forward. And so through that patient family advisory community, which I'll talk about more in a moment, we generated this PFA Summit. And over the years, we've had some great collaborators. And this year, we were so fortunate to work very closely with Discern Health, who you'll hear from in just a few moments, to co-design a very effective summit. We also had the privilege of being hosted by the National Quality Forum, who actually invited us into their space and gave us the meeting support to host. In addition, we also were funded by the Patient-Centered Outcomes Research Institute. With that, I think I'm going to pass quickly over to Teresa to introduce Discern Health. Teresa?
Well, good afternoon, everyone. Thanks, Libby. Thanks, Lindsay, for the great introduction. My name is Teresa Schmidt, and I'm a Vice President at Discern Health. I'm joined today by my colleague, Alexis.
Hi, good afternoon, everyone. This is Alexis. I'm a Senior Project Manager with Discern. Thanks.
And we've confirmed that both of our audio works, so that's going to set us up very nicely for our future slides. Discern is a research and advisory services firm. We work with a variety of stakeholders throughout healthcare, from patient groups, provider organizations and associations, to payers and life sciences companies and government agencies. So we really believe in the mission that Libby was telling you about, and in the ability of other healthcare organizations to collaborate with patients and families to improve healthcare delivery and experience. We also believe very strongly that there are better ways to define and measure value in healthcare. So a lot of the work that we do at Discern is helping our clients to understand how healthcare is changing. And right now, as we all know, the landscape is changing very rapidly. And then respond strategically to those changes to ensure that the delivery systems that are set up really encourage delivering value to patients and families. So we've really enjoyed our collaboration with PFCC Partners and the PFA Network over the last year or so to plan the summit and organize the insight from the fabulous conversations we had back in January on that day. So Alexis and I will look forward to talking with you more in a little bit and sharing these insights.
Thank you, Teresa. It's been such a wonderful collaboration, and we have learned so much from you all, and it's just been extraordinary, so thank you. I did want to give a shout out to National Quality Forum. National Quality Forum, I'm sure most of you are familiar with them, and you can see a little description here on the screen, but I have to say, for PFCC Partners and the PFA Network, the National Quality Forum has been an extraordinary partner for many years, always really making space for the patient and family perspective to inform their work on delivering quality metrics and measurements across the healthcare space. So we are deeply grateful for our partnership with National Quality Forum as well. All right, so I'm going to give a bit of contextual information for the summit, and before turning it over to Teresa and Alexis to get to the good stuff. The PFA Network is a community of over 600, as I said, patient-family advisors, those folks using their lived experience, like myself, using my family's lived experience navigating the health system over the last 25 years, to inform it and to partner across healthcare systems, across healthcare activities. The PFA Network has three central purposes. One is to create a sense of community and fellowship between patient-family advisors. It can be sometimes isolating work to do, and sometimes a bit of a heavy load. So we really seek to provide that community aspect. Secondly, we provide skills exchange. This would often be referred to as training, although we know that all of our programs are influenced and informed and improved by the patients and family advisors who are participating in them. So we come together to work on the core competencies of effective partners, quality improvement basics, measurement basics, and other opportunities to exchange skills as well. And then finally, we provide a bit of a matchmaking service for those organizations who are seeking experienced advisors and effective partnerships. So we serve to connect folks. So the history of the PFA Summit, several years ago, 4 years ago, we noticed a trend of really exciting expansion of patient-family engagement and the engagement of patient-family advisors to build the person-centered health system. And as exciting as that was, we also saw a bit of an emerging gap between some of our national partners and our national drivers of patient-family engagement activities and the advisors themselves who were working on the front lines in health systems to really understand what that role looked like. And so the history of the summit was to bring together patient-family advisors in large groups and bring together a handful of federal partners for a co-learning event where advisors could learn about these policies and policy organizations that were driving this change. And the leaders of these organizations could join us to learn about what it's really like to be a patient-family advisor and what the opportunities are in front of us. So since that time, that's our first summit photo down there in the bottom. And since that first summit, we've had now 4. the last one focusing on the opioid response, and a great partnership with the Institute for Patient Family-Centered Care on that one. So the summit is really an opportunity for advisors to meet and have our healthcare partners join us, where most of us experience the flip-flop, right? We attend healthcare conferences in fewer numbers. This is sort of the flip of that. Next slide, please. So as I mentioned, I'll mention that PFCC Partners is celebrating its 10th year this year, which is phenomenal to me. I think where I started at my kitchen sink, I should say, and how much we've grown. We were really focused on hospitals and hospital PFACs. And over the last particularly 3 to 4 years, it's just exploded in the number of potential partnerships. We're partnering more largely with health systems and really helping to co-design delivery of care and policy. We're partnering with so many research teams. The work that Patient-Centered Outcomes Research Institute has created space for these amazing partnerships has now gone into, we're also working with research teams from the National Institute of Aging and National Institutes of Health. So really spreading into our national quality improvement efforts with the QIOs. I see lots of my QIO friends on the call. Thank you for joining us today. Into measure development. And so we saw this emerging partnership into how can patients and families with lived experience really inform the development of meaningful quality measurement. And in the capacity of the measure development sphere, it's not a real natural sort of integration. And so how can we develop and think about new and improved ways to collaborate in that space? And so that became, of course, the focus for the 2020 Patient Family Advisory Summit. Next slide, please. So what do we need when we convene federal partners and patient and family advisors? We need context, 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 context. And so what we provided the advisors who were attending the summit were these 3 documents. The Person and Family Engagement Toolkit, developed by the Center for Medicaid Medicare Services, the American Institute of Research Principles for Making Healthcare Measurement Patient-Centered, and the Pharmacy Quality Alliance Patient Family Engagement Quality Measurement Rubric. These were selected to highlight, just to really provide some of the context of and foundation that had been developed in the recent past around this engagement and partnership with patients and families and the measure development process. We shared these contextual pieces of information with the advisors attending through an orientation, and really kind of gave that opportunity to take a deeper dive in those offline before we came into the room, so that we really could optimize the time that we were together in the room to think more thoroughly about what we needed next and where do we go next from these efforts. With the next slide, please. Thank you so much. I have to give a huge shout out to all of you who are on the call, who were part of the Patient Family Advisory Summit planning team. Most folks are patient family advisors and leaders from the PFA network, along with, of course, our wonderful partners at Discern. And together, we really, this group spent just over a year really thinking about what would a valuable contribution to partnering with measure developers, what could we do that would really move that forward? And that became the agenda for the Patient Family Advisory Summit. So thank you to all of you who volunteered your time to make the summit what I thought was just a robust, incredible day of co-learning. So what were our goals? As a planning committee, we really had 3 primary goals. One was to co-design patient family engagement and measure development just by the fact of bringing ourselves together in a room with measure developers, with CMS in the room as well, with American Institute of Research in the room, and Pharmacy Quality Alliance, and several other partners to model what this can look like. And really, quite frankly, I'll be really straightforward as I usually am, really wrestle with how are we going to do this? This is not easy and it's an emerging area. So come together and let's think together, let's be prepared and really move things forward. How were we going to do that? We had to identify the gaps and the opportunities and really acknowledge what the current measure development process looks like. We had to surface key barriers and think about how we might overcome those challenges. And we'll hear much more about that from Teresa and Alexis. So those were our goals. Who did we have here? Here's a great map. Hopefully we'll share these slides afterwards, but I just want to recognize that we had folks from a lot of different regions of the country. We had good diversity. You know, we had an application process whereby advisors could apply to join us at the summit. We had over 70 applications for 30 spots, and so 34, I should say, spots. So these are the folks that came, and the applications, of course, everybody we had apply were fantastic, and it was hard to say no to anyone, but it was really about getting the most diverse group of advisors into the room that we possibly could so that we could really expand thinking. So we had diversity of region, we had diversity of age, we had diversity of lifestyle and of culture and ethnicity, and it was really just a very strong group. Next slide, please. We can't have great partnership conversations without having some great partners. These were all of the organizations that were represented in our conversations. We had roundtables, and each of the national partners was at a different roundtable with advisors to really create that co-learning opportunity and conversation. So we are grateful to all of these federal agencies that saw the value in partnering with patients and families and were willing to take a time out of very, very busy schedules to join us for the day-long session. We really appreciated the collaboration. Next slide, please. So a little bit about the agenda. If any of you have attended PFCC Partners meetings in the past, you know that we are not much for a flat agenda. We really like a lot of interaction, a lot of conversation, because we know we don't have the answers. We're just about facilitating those integrated conversations. So again, this agenda was very active. We started with some level setting, and then we looked at some of those the programs from AIR and PQA in more depth. We heard from Dr. Michelle Schreiber and Dr. Laura Forsyth from PCORI. And then we set about table activities that could digest the information that we had heard and really illuminate some of those future opportunities for more meaningful partnership with patients and families in the measure development process. So quite an active agenda. We are always committed with the PFA Summit to producing actionable outcomes. So with that, I think I will pass on to Teresa and Alexis to take us through what we developed.
Well, thanks for the overview of the day. And I think that the point that Libby made that resonates the most with me is that we were there to learn. And we had so many great teachers in the room from the national partners that have been thinking deeply and writing about these questions, to the patient and family advisors who have been, in some cases, already participating in measure development and can share what's been working, what hasn't been working, and what their experiences have been, as well as what they would have liked to experience and how that might be different from reality. So we tried to reflect the all teach, all learn approach as we were pulling together the outcomes from the day. As you saw from the agenda on the last slide, the program was designed to be highly interactive, mixing presentations, responder panels, and those engaging group exercises like a word cloud, breakout discussions, independent writing and thinking, and dot voting. And these were intended to bring all of the voices to the table to address the key topics that Libby's already outlined, answering the questions, what are the gaps and barriers to meaningful engagement? How should we really be defining patient and family centered when it comes to measure development and measurement? And then what strategies do we think would be critical to overcoming the barriers that we identify? Basically, we discussed the current state of PFA engagement and measurement, the desired future state, and then thought about how to get there. So throughout the day, Discern and the other summit organizers documented the proceedings and collected the worksheets, the flip charts, all those little yellow Post-it notes, and consolidated all of the information. Then Discern brought it together, analyzed it to discover the most common themes and key takeaways. And we're currently putting the finishing touches in collaboration with PFCCpartners on a report that summarizes these findings in detail. But we're happy today to be able to share some of the key takeaways with you in the coming slides. And I think just based on what we've learned, that we absolutely had some great people at the table to help teach us. And that we're hoping this information will inform practice and has, in some cases, already started to inform the practice. On the next slide, we'll show the results of one of the first exercises that we did during the day to better engage patients and families in the measured development life cycle. We started by thinking about what some of the current gaps might be, because we all know you have to understand what the problem is before you can solve it. So I'm a visual learner. So I love word clouds because they're a great way to visually represent the feelings and thoughts of people in a room that might be more difficult to pull out everyone's opinions via group discussion. So we asked the question of the participants in the summit, in one word, what do you think is missing from healthcare measurement? And then the summit participants used their cell phones or laptops to type in answers. And the word cloud was created in real time so we could talk about it at the summit. And the more times a word was entered in, the bigger it got. So as you can see from this slide, some of the big concepts, the things that we may believe are missing from healthcare measurement are equity and diversity, transparency, compassion, communication, purpose, and the use of those partnering words like co-design, and partnership in general. So this really kind of took the temperature of the folks in the room and set the foundation for what we would learn in the coming exercises. The next slide outlines the general flow of that current state, future state, how to get there that I mentioned a couple slides ago. So we worked through all of the various exercises to establish the shared vision or the end goal. What would person and family-centered partnership and measurement be? And then how would we get there by addressing some of the key gaps? So some of the key gaps that were surfaced in the word cloud, but also in the discussions we had afterwards. We had small table discussions and wrote on the flip charts to generate the ideas that lack of inclusivity is a problem, time and other participation constraints, structural pressures, a lack of trust, poor communication. And we'll dig into this further on the next slide, but it's also important to realize that to get to this end state where we have measurement that's inclusive, supportive, capacity building, we need to pursue some solutions. Though we've gotten part of the way there, we have farther left to go. And some of these that we'll again talk about in just a second include partnership, mentorship, and that critical concept of inclusivity and diversity. So I've set the table. Now I'll turn it over to Alexis to talk through each one of the various courses.
Great, thanks so much, Teresa. So diving a little bit deeper on the gaps that Teresa just introduced, One thing we really consistently heard from folks throughout the day was this lack of inclusivity or diversity. And what we heard is that PFAs who participate in measure development may not represent a full spectrum of race, ethnicity, socioeconomic status, language, gender, geography, clinical conditions, functional limitations, and ultimately lived experience. We also heard about time, finances, and other participation constraints, that PFAs may not be able to participate fully due to financial and time barriers, which can be especially challenging for folks that are in treatment or have young children, lack access to transportation, and also have full-time jobs. Misalignment of measure development goals. Measure developers may not always see the value of engaging patients and families in the most meaningful way, and we found that stronger relationships between PFAs and measure developers would be able to help promote this alignment and establish that shared end state or shared goals. We also heard, again, poor communication was a barrier. Measure development stakeholders might not use the same terminology or have the same understanding of healthcare processes and treatment experiences as PFAs. And given that, it's really important to train PFAs on measure development and healthcare quality terminology, while measure developers should be trained on how to better communicate with patients and families. And lastly, again, that structural piece, the structural pressures of the measurement process. So adhering to some of the prescribed activities of measure development can actually create barriers to active participation from patients and families. Again, the point about limited time and resources that can prevent PFAs from being able to participate from start to finish. And some measure developers might measure success as meeting deadlines rather than creating and maintaining a measure that is effective and highly valuable for patients and families. If we can go to the next slide, we can talk about our goal. So by the end of the day, we were able to establish our shared vision for the ideal approach to a person and family-centered partnership in measurement, which we identified includes 3 key considerations that are ultimately grounded in respect to facilitate that all teach, all learn environment, which, as Teresa mentioned, we had designed the summit around. So that first consideration is inclusivity, that there's diversity among PFAs across their lived experiences, bringing the right people to the table. And further, PFAs should be ingrained more deeply and meaningfully in not only the measure development process, but also the ongoing implementation, use, and evaluation of measures. The second component is support. Stakeholders should recognize the contributions of PFAs and offer equitable compensation for participation, which can include financial compensation, but also other forms like childcare or transportation. And developers should also offer the flexibility and timing and options for participation. So, for example, virtual participation for PFAs in rural communities or for those unable to travel, there could be opportunities to participate in measure development beyond participation in a technical expert panel, and that there should be ample resources for PFAs to be able to participate to ensure access to trainings and orientations and glossaries, whatever PFAs need to be able to meaningfully contribute. And the third element is a capacity building piece. So measurement strategies should meaningfully involve patients and families from the start of the life cycle, and there should be close communication with PFAs throughout the entire development process. And training should be more comprehensive, both for PFAs, but also for developers. And during the summit, we noted that training for PFAs should address expectations for participation, measure and quality terminology, the measure development lifecycle, and the role of measures in the broader healthcare system for that contextual piece. And on the measure development or industry professional side, participants noted the need for, again, that contextual training on ways to communicate with and engage PFAs, the purpose and logistics of patient participation, and how PFAs are trained on measure development activities. So in order to reach this ideal approach to measurement, we brainstormed and prioritized those actionable strategies towards the end of our summit meeting to actually get there. And with that, we want to hear from you on what you all think. So I think that Lindsay at this point is going to be pulling up a poll on our priorities. So our question to you all is, which 3 strategies would you prioritize to close gaps and develop meaningful person and family-centered quality measures? And we ask that you only select your top 3 out of the following options so that we can really see which ones surface to the top. And the options that we've put on the screen are establish a mentorship and coaching program, partner with payers and foundations, insist on diversity, develop guidance around compensation for PFA contributions, develop a strategic plan for including PFAs in measure development, and convene a roundtable, provide experiential learning opportunities for providers, expand guidance for developers, and develop educational tools for PFAs and other development participants. And if there's something else that isn't on this list, definitely we encourage you to please enter it into the chat box. We'd love to hear from you.
And I see poll responses coming in. I just want to make sure that everyone is able to see the poll.
Yes.
And
okay, great.
And just a reminder too that there's a lot of different options. So I think that you can scroll down in the poll to make sure that you hit everything.
Perfect, thank you. We have about 18, 20 responses. We'll leave it open for another 30 seconds. I gotta say, it's fun to watch the responses come in. Okay, another 10 seconds. Last minute responses. Okay.
Hi, I'm sorry. I'm not able to see the poll anywhere.
If you're on the phone, you would not, unfortunately, be able to participate in the poll.
No, I'm on the computer also.
Okay. Unfortunately, I just ended the poll. But
Okay, no problem. No problem.
Yeah, you can also chat in your responses as well.
Okay, thank you.
No problem. Thanks.
We certainly want to capture your responses,
Yes.
so please do invite you to check off any of the 3 that you see there.
Okay, I've shared the responses. Can everybody see that?
Yes, thank you.
Mm-hmm.
Are you able to keep up the poll results while we go to the next slide?
I should be able to. Can you see the next slide?
You got it.
Yes, perfect. Thank you so much. So it's interesting to see what folks had selected as their top priorities in comparison to what were the priorities that had surfaced during the summit. So during the summit, the top priorities that were identified include establish a mentorship and coaching program, partnering with payers and foundations, insisting on diversity, developing guidance around compensation, and developing a strategic plan for including PFAs in measure development and convening a roundtable. And interestingly, it looks like our top responses to the poll are that strategic plan, we're seeing that come up again, and developing more educational tools for PFAs and other development participants. So it's interesting to see, a couple of months later, what might have changed. And looking at the percentages, it seems like the mentorship and coaching program is still relatively higher priority on the list. And see what else is here. Insisting on diversity, again, something else that rises to the top as well. So with that, Libby and Lindsay, I can turn things over back to you.
Great. Thank you so much, Alexis and Teresa. I love doing that poll and just seeing that there is so much commonality. And even though I would say the composition of the group we have on today's call is much more heavily weighted towards the healthcare professionals, even though we have a lot of advisors as well. So it's interesting to see that that is sort of still holding true. So anyway, thank you for your participation and sharing your thoughts with us. So I'd like to invite Roger LaCoy and Ayadala Anis, two folks who joined us at the PFA Summit, to join us in a little bit of conversation and sharing about your experience for the summit. So let me start with introductions, although I'm going to read you their amazing credentials, although I could give a very personal introduction to both of these fantastic people. Roger is a patient advocate and board member at PHC in Des Moines, Iowa. He also chairs the agency PFAC, Patient Family Advisory Council. He's the president of Pitch, Positive Iowan Taking Charge, love that, a nonprofit organization for people living with HIV/AIDS in Iowa. He's been living with HIV/AIDS for 28 years, being active in his healthcare from the beginning. And we also have Ayadala Anis, is the Director of Value and Culture at the National Academy of Medicine Leadership Consortium for a Learning Health System. In this role, Ayadala directs efforts that focus on transitioning health payments from fee-for-service to value and population health, as well as individual and community strategies and equity approaches for health improvement. Before joining NAM, Ayadala worked for the Patient-Centered Outcomes Research Institute, where she managed $78 million of patient-centered comparative effectiveness research portfolio that tested interventions to improve healthcare systems and health equity. So welcome, Raja and Ayadala. Do we have Ayadala? I know I saw Roger.
Yes, I'm here.
Oh, fantastic. Thank you so much for taking the time, both of you, to join us. So I guess I just wanted to start with a question about, we'll start with you, Roger. What were your expectations coming into the summit, and maybe then what surprised you about participating in the summit?
Well, as you know, it was my first time attending the summit, and first time being a member of the advisory council. I originally started doing work back in the early days, being a patient family advisor and a patient, doing one-on-one patient counseling and stuff. I think what I expected was, I had been to the CMS quality conference prior to going, and then I got into developing and learning my skills, and it was through that I had come in contact with you all. So my expectations were, I thought it was going to be something where we'd go and it'd be just a group of people meeting, which it was, but I didn't prepare myself enough to really understand what we were getting into. It was a lot of technical things that I didn't understand at first, but I did have, Teresa was next to us, and she did help us out a lot. So my expectations were, I was really surprised at the knowledge that everybody had in the room, and the willingness to share and be open about their services or where they stand in when we were talking about the summit and doing the measure development. Great people, great organization. I was pleasantly surprised, and since then I've been also following through with the workshops and trying to learn more as we go along, and I always like to learn. So
Fantastic.
It was amazing. It was amazing.
Fantastic. Well, we were so grateful for you traveling to be with us in Washington, D.C. And I agree. I felt like it was a very trusted environment at the summit where everyone could really own their own perspective and feel really comfortable in sharing that, and listening to all of the other ones. So with that, Ayatollah, we've been so blessed to have the National Academy of Medicine participate in all of our summits. And as such a leader, it's just been fantastic to have you join us at this year's summit. So what were you expecting going in, and sort of, what surprised you about the meeting?
Sure. Well, I want to thank you all for having me at the summit, and for having me here to just share with you a little bit about my experiences. So this was actually my first PFCC Partners kind of meeting and summit. And so I think I was a little jaded by being in DC for so long. And I expected a good meeting with some good presentations and, certainly getting to interact with people and talk to people. But this was one of the best meetings I had attended in a very long time. And part of that was the ability for the meeting and the meeting participants to interact with each other in such a genuine way, that it made the summit very humbling, and it made it a grounding experience, but it also elevated all of our thoughts and perspectives. And so what I walked away feeling was that there was so much synergy in the room, that it was no longer 1 + 1 = 2, but more like 1 + 1 = 100. There was just that much engagement, that much robust action-based conversation, and desire for change.
Thank you so much. It was such an honor to have you be there, and I know it was a bit probably a different meeting than you're used to attending. Sometimes I think we should just tell participants to wear their running shoes. But one other thing that most of the day was spent talking about, really, how can we improve this partnership? So what ideas do either of you have about improving this partnership in measurement development activities? Sorry.
Well, I think one of the things we should do is allow more time for patients or people who are coming to educate themselves on the topics and get their stories together, be a little better prepared than I was to say. But yeah, I think in doing the buddy system too, I think that would be an awesome thing.
Mm-hmm.
I do have Rosie is my mentor. I haven't reached out to her yet. I'm sorry, Rosie. I know you're on. But yeah, I mean, those aspects and the willingness for everybody in the room to just share their opinions and being honest and open and not worry about anything. I think the environment was just awesome. And I think just a little more information, I think, would help somebody like me who's not into measurement as much.
Great. I really appreciate that. Thank you, Roger. Ayatollah, what ideas do you have about improving the partnership?
So in terms of improving the partnership, I think my comments, I'm going to think just a little bit, higher rather than, because I think the partnership is doing so much. But I just want to add to some of the comments that have already been shared. When we talk about equity, and diversity, there's diversity, there's inclusion, and then there's belonging, and making sure that we're doing just a really good job of engaging diverse groups of people in a way that they feel like they're recognized. And there was a lot of great diversity in the room, but thinking about making sure that there's that same level of diversity and engagement in measure activities. And so thinking about groups that we should be reaching out to, that might represent some of the people who typically aren't at the table. So thinking about reaching out to historically Black colleges and universities, looking at organizations such as the American Coalition of Citizens with Disabilities and others, to make sure that we are very conscious and aware of making sure that there are other people who are at the table, and that we're working on strategies to make sure that they feel like they belong. And also, there are some great materials that are out there. You shared 3 of them that were shared with the group, and there are others that are already in existence. And so rather than always feeling like we have to reinvent the wheel, to make sure that we can compile and have just one repository for information on engagement and partnership, and specifically as it relates to measurement, to see what's out there, and then to think then about what is necessary to create. And then we've already talked a little bit about training, and especially training for the measurement experts. And it's important that that training includes how to facilitate meetings, because we're used to infrastructure and a system and a way of doing things. And what we're asking people to do is really to think outside the box. And sometimes they need training on how to do that. And how to make sure that you're able to hear everybody's voice, even if it's different, even if it's saying something that you yourself might not agree with. And so I think training on how to adequately facilitate and effectively facilitate meetings is critical. And then also training on unconscious bias. I think some of what we're seeing as it relates to disparities has to do with unconscious bias, and just being able to recognize our own personal biases and how that might impact how we relate to and interact with others, so that we get to that true engagement and allowing people to feel like they belong.
Great takeaways. Thank you so much. I love the idea, and there's always, or there are, as you said, so many resources for this partnership and measurement development beyond the 3 that we shared. And I think that's a worthy endeavor to kind of compile those resources. So we're not reinventing the wheel, we're building on what's existing. Certainly your ideas around diversity and inclusion and belonging, I really like that, and we heard that very clearly at the summit in many, many different ways about how each of those things is so unique and so critical to this effort. So I really appreciate that. I'm going to ask you just in 10 seconds each to, at the end of our meeting, as is the case again with many of the PFCC Partners meetings, we want to leave an action. So we asked each of the participants to complete a commitment form and then leave it with us. And then they were received their commitment forms a few weeks later in the mail, just to re-energize their spirit they were leaving the room with. And so just really quickly, how are your commitments going, Roger and Ayadola?
I'm still sticking to the plan. I've been spreading the word amongst my people here on this in Des Moines, and people
Fantastic.
just keeping it going. Fantastic.
Thank you for your efforts, Roger. Ayadola?
Yes, so I have been working with my team at the NAM to figure out how we can engage patient and family partners in the work that we're doing on measuring engagement. And then we have been talking about standing up a community and equity advisory group for the NAM Leadership Consortium.
Fantastic. Well, you know, we are here as a resource anytime, and I say we as in the larger community of patients and families. So with that, I see some questions coming in the chat box. Lindsay, I'm going to turn it back to you and thank Roger and Ayadola for joining us and sharing your reflections. Really appreciate it.
Thank you.
Yeah, thank you both so much. We really appreciate you being here and sharing your own perspectives. We do have some questions coming in. I've been trying to answer a few. But one question from Joe Connell, and this can be to Libby, Teresa, or Alexis: what are the next steps to keep the momentum of summit outcomes going forward?
Teresa, do you want to take that one?
Sure thing, and we actually have a slide for that. So one of the things, and Libby, I'll let you jump in on this as well. One of the things that came out of the summit very strongly was this idea of a mentorship program, and that could focus attention both on helping patient and family advisors that have participated in this process mentor people who are new to that, but perhaps even more importantly, having patient and family advisor mentors that are available to these national measure development organizations to help give them some of the training that Ayadola was talking about just a second ago. So this is something that Libby's been talking a lot about and is a very exciting opportunity. Do you want Libby to say anything else about this?
I think this is something we're, as a community, really committed to. I think we've heard from so many different people and within the community and external to the community and our measure development partners about how valuable a mentorship program would be. So absolutely stay tuned. There is much more to come on that.
Yeah, and I'll just add that as somebody who has been involved in a lot of these discussions with some of the national partner organizations that we mentioned earlier, as well as others, we don't know what we don't know. So when you go into those conversations and you've reviewed some of the great resources that are already available and that we'll be listing in our outcomes paper, you'll have a certain conception of what might come out of a conversation and what you might learn from somebody's experience. But until you've actually listened to that person and listened to multiple people, you don't know what you don't know. So that's why I think the idea of the mentorship program could be so helpful. So that's the first. The second is a follow-up email early next week with the recordings of this session today, as well as a link to the outcomes paper. We're putting the finishing touches on this document, as we mentioned. And we really hope that from the Discern perspective, that this information can be disseminated broadly. So when that's available, we certainly invite all of you to share with your networks as well. Libby, do you want to add anything?
No, I think you summed up very well. Are there any other questions we're leaving hanging, Lindsay? I want to comment on John's comment. John Shaw, it's so nice to see you, John. The role of the community health workers, I agree 100% that you know, the PFA network is looking at how do we connect with community health workers, and we've got some wonderful leaders in that sector who are we need to create stronger linkages with. So it's certainly the voice of the community, and how do we navigate, you know, including that voice and that perspective in a way that is inclusive, is meaningful. But I agree with you 100%. Maybe one more question, Lindsay?
Bill just posted a question that goes along with what we were discussing regarding the mentorship program, is what can we do to support that program? Oh, I'm sorry, that was Marty who asked that.
Hi, Marty. It's great to see your name as well in there. I think we are in the early stages of planning and certainly want to stay in touch with all of you who both attended the summit and who are interested in a mentorship program. So you'll be hearing a lot more through the PFA network, virtual meetings, the Yammer community, all the regular places we touch points. So definitely more to come on that. And I guess Alexis and Teresa, did you have any final comments you wanted to make?
Just that for me, it's so great to be seeing faces again of folks that we connected with during the summit, and just have so appreciated working with all of you to help better understand this topic and set the stage for future work together.
Absolutely.
And yeah, this is just Alexa. I would just thank everyone for their time today, and I couldn't agree with Teresa more. So thanks again.
Absolutely. I mean, if we could take the level of authentic partnership that the PFA network members have had with Teresa and Alexis at Discern, and the folks at National Quality Forum and PCORI, you know, we just need to amplify, right, and include and be more inclusive. And so this is really exciting to think about moving forward. And so I guess as we close out, I just want to first of all wish you all wellness and health, and in these unprecedented times we're living in. I'm a firm believer in connection, and it may look a little bit different using lots of Zooms, but I also want to make the offer to all of my patient family advisor colleagues and others, to all. We are hosting Friday morning coffee chats, and it's just a time to come together and be together and connect. And so if you're feeling at all isolated, we are here. The PFCC Partners team is here. Pick up the phone, send us an email, whatever it might be. We're all in this together. So just that offer to remain connected. All right. Be well, peeps.
Stay safe out there.
Thanks,
Or in there.
everybody.
You too.
Thanks,
Bye.
everyone. Bye-bye.
Bye-bye.
Thank you.
Thank you.
Thank you.